Hello everyone, welcome to Bit of Anatomy. In this gross anatomy lecture, we will see the features of the face. So if you appreciate the face, it contains various orifices for the eyes, the orbit, then there is orifice of nose, the oral cavity and the ear. So it houses most of the sensory organs in this region. So if you see the boundaries of the face. So what all things before that, if we see what all things we should know in the face, we should know what are the boundaries, what are the features of the skin and the superficial fascia, what are the various muscles that are present here, their attachments, their actions, and the blood supply, the nerve supply and lymphatic drainage of the face. First, if we see boundaries of the face. So the boundaries of the face, the lower boundary is by the lower border of the mandible or base of the mandible and also the chin. This forms the lower boundary, and the upper boundary is considered by the hairline in the upper part. So of course, depending upon the hair it can vary, but this point is considered as the upper border. So this region, which we call it as forehead, so it belongs both to the scalp and also to the face. It is common for both scalp and the face. So if you see the features of the skin here, the skin here, it is a type of the thin skin since it has got various hair follicles and the hair. So and this skin, it is very rich in sebaceous gland and also the sweat gland. And the speciality of the sebaceous gland here is, in other parts of the body, the sebaceous gland function, it is controlled by the nerves, whereas here it is controlled both by the nerves but mainly by the hormones. So because of this, because of the hormonal changes and blockage of the sebaceous gland, there will be appearance of the acne at the time of the puberty. So that indicates that it is controlled by hormones and not by the nerves. And one more feature of the skin in this region is it provides attachment to the facial muscles. So that is one of the specialty of the facial muscles. So on one side it is attached to the bones, on the other side it is attached to the skin region. And if we appreciate the superficial fascia, it is within this superficial fascia all the nerves and vessels will pass and supply various parts of the face. So in any other region of the body, beneath the superficial fascia, there will be a layer of deep fascia. That deep fascia, it is absent in the face. So the main reason why it is absent here means, so the absence of the deep fascia, it allows the movement of various facial muscles. If deep fascia was present here, which is usually the thick fascia, so such minor movements in the face, especially the movements for facial expressions, it would not have occurred. So it is absent from the entire part of the face except a small region over the parotid gland and a muscle here which is called as masseter muscle. Over that, the deep fascia is present. Apart from that, there is no deep fascia. And even one more point in the superficial fascia is the subcutaneous fat. It is present in most areas, more concentrated in the buccal region where it forms buccal pad of fat. But this subcutaneous fat, it is absent in the eyelids region. So these are the major features of the skin, the superficial fascia and also the deep fascia. If you see the features of facial muscles, some of the general features, so all these facial muscles, they are present beneath the skin, they are subcutaneous in nature. And as I said already, the speciality of the facial muscle is on one side it is attached to the bone, on the other side it is attached to the skin region. So where these facial muscles are present and what is the basic function of these facial muscles? So as I said, there are various orifices in the face region, and the basic or primary function of all these facial muscles is closure and opening of these orifices. So that means it helps in closure of the eyelids, closure of the lip, closure of the nose and even the movement of the ears. So if you see in some lower animals, they can move the nose like elephant which has got a trunk which can move it, which has got very strong nasal muscles. So in human beings, there is not much action of these facial muscles in relation to the nose. And also if you see the ear, so in the lower animals, they can move the ear to various directions. So that action, it is lost or it is not present in most of the human beings. In some small amount of movement can be possible. So these muscles of the ear and the nose, they have become rudimentary. Not a major action is seen. Whereas in relation to the orbit and the lips, the action we can clearly appreciate. And all these facial muscles, they belong to a group of muscles which is called as Paniculus carnosus. So what do you mean by this paniculus carnosus? So if you take the example of an animal like cow, so if a fly sits on the skin of that animal, so it can shake off the skin because of the presence of the muscle called as paniculus carnosus, which is present throughout the body. In human beings, that muscle has disappeared from most parts of the body, so it is present in the face to a certain extent. So if you remember the upper limb muscles, so near the hypothenar eminence, there is a small muscle which is attached to skin here called as palmaris brevis. So that is also one of the example for paniculus carnosus. Whereas all the muscles of the face, they belong to paniculus carnosus group, where on one side it is attached to the bone, on the other side it is attached to the skin, and not the insertion is not into any bone. So as I said, primary action is the closure. So in the lower animals, the action is limited to this. There is no other major action. But in human beings, what happens during the process of evolution? So these muscles, they also help in producing facial expression. So when we cry, when we are angry, when we laugh, all these muscles will result in facial expression. So gradually, the primary function is superseded by the secondary function or the side effect of the facial muscles, that is the facial expression. So because of this facial expression and because of these finer movements, all the muscles of the face, they contain smaller motor units. So what do you mean by motor unit? One nerve fiber supplies how many muscles is called as motor unit. If we take the example of the deltoid, which produces gross movement, so it has got larger motor units. That means one nerve fiber will supply 100 or thousands of muscle cells. Whereas in the face, these smaller muscles have got smaller motor units. That means one nerve fiber might supply only 10 muscle cells, or it might supply only single muscle cells, so that the action is very much precise. So these are the general features of the facial muscles. So if you appreciate the muscles around each of the orifice, quite a horrible diagram. Anyway, it will do the job. So there will be muscles around each orifice. So if we appreciate first the muscles in relation to the orbits, so near the orbit, so there will be a muscle extending from superciliary arch. So this is called as corrugator supercilii. And in addition to this, there will be frontalis muscle, so which we have already seen or appreciated in the scalp chapter. And there will be muscle around the eyelids, which is called as Orbicularis Oculi. And there will be one more muscle which we will study under the chapter of the orbit, which is called as levator palpebrae superioris. It will act upon the upper eyelid, but it is present inside the orbit. So these are the major muscles in relation to eyelids. So if you see muscles in relation to the nose, so medial part of frontalis, it will continue along the root of the nose. So this is called as procerus muscle. And there will be a muscle extending from maxilla of one side to the maxilla of the other side. And a small part of it will also attach to the alar cartilage of the nose. So this is overall, this is called as nasalis muscle. So this is known as the transverse part of nasalis, and this is known as the alar part of nasalis. Or functionally they are also called as compressor nares. Since it crosses the nose, it will compress the nose. This is called as dilator nares. Any of the actions of these muscles, they are not very prominent in human beings. And there will be one more muscle which attaches to the septum, a small muscle which attaches to nasal septum. It is called as depressor septi, since it produces depression of the nasal septum. So next, if we see muscles around the muscles related to the lip. So there will be a muscle which arises from the maxilla, which goes all the way down to the upper lip, and a small part of it will also go into the nose region. So this muscle, it is going to the upper lip, so it is called as levator, since it elevates the upper lip, so it is known as labii superior, so refers to elevates upper lip. And since it also gives few fibers to the nose, it is called as levator labii superior alacae nasi. So this is the longest name of all the difficult muscles that are present in the face. So apart from this, there will be one more muscle arising from the maxilla, which again goes into the upper lip, so which elevates the upper lip. So this is known as just levator labii superioris. There will be two more muscles coming from the zygomatic bone, one going into the upper lip and one reaching the angle of the mouth. So these two muscles, they are called as Zygomaticus muscle. So the lateral one is the larger one, Zygomaticus major, and the medial one is the smaller one, which is called as Zygomaticus minor. And there will be one more muscle reaching the angle of the mouth, coming from the maxilla, which is called as levator, since it elevates anguli oris. So these are the muscles of the upper lip, levator labii superioris alacae nasi, since it gives a small slip to the nose, levator labii superioris to the upper lip, zygomaticus minor to the upper lip, zygomaticus major to the angle of the mouth, levator anguli oris. As the name suggests, it goes into angle of the mouth in this region. And if we see muscles in the relation to the lower lip, so in the chin itself, there is a small muscle called as mentalis muscle, and there will be a muscle which goes into the, coming from mandible, which goes into angle of the mouth, called as depressor anguli oris. So you see how they have named this muscle. So it is depresses the lower lip or depresses the angle of the mouth. That's why called as depressor anguli oris. And similarly, there will be a muscle which will depress the lower lip. So it is called as depressor labii. So that means it produces depression of the lip. Which lip it is depressing? It is depressing the lower lip. Hence it is called as depressor labii inferioris. So this is how the muscles are named here. And there will be one more muscle extending from the muscle that is present in the neck region, which is called as platysma. So this muscle which extends again into the angle of the mouth, so it is called as risorius muscle. So these are major muscles in the lower lip, the mentalis, the risorius, which is extension of the platysma, depressor labii inferioris and depressor anguli oris. So as you can see, there are numerous muscles in the lip region. So all these muscles, they will merge with each other around the lip and form what is called as Orbicularis Oris muscle. So which we will see in detail later. And in addition to that, there will be a muscle of the cheek which contributes largely to the Orbicularis Oris, called as buccinator muscle. So these are the various muscles of the face, around the orbit, around the nose and around the lip. And there will be muscles even around the ear, one small muscle in the front part, in the upper part, lower part and even in the posterior part. All they are called as auricularis superior, anterior, inferior and posterior. Since there are no much movements in our ear, so those muscles we can skip. And even in all these muscles, in general you should know the situation of these muscles and what is the basic function of these muscles, which we will see later. So in detail, you have to know some of the muscles in detail, like Orbicularis Oculi, the buccinator and the Orbicularis Oris. First, if we see the features of Orbicularis Oculi muscle. So why they have named it as Orbicularis Oculi? Because it encircles the entire eyelids, so it is present around the eyelid. That is why it is called as Orbicularis Oculi muscle. So this Orbicularis Oculi muscle, so it has got various parts. So it has got mainly three parts: the orbital, the palpebral, which is present in the eyelids, and the lacrimal, so which has got action on the lacrimal sac. So first, if we see the orbital fibers. So if you see the orbital fibers, all these orbital fibers, it will arise from a ligament that is present over the medial aspect, which is known as medial palpebral ligament. So the fibers arise from the medial palpebral ligament. They will pass through the eyelids. They will not insert anywhere in the lateral aspect. They will encircle the entire eyelids and they reach again back into the medial palpebral ligament for insertion. That means both the origin and insertion point is same. Arises from medial palpebral ligament, encircles the entire orbit or passes through the eyelids, no attachment over the lateral side, inserts again into the medial palpebral ligament. So the upper fibers of these orbital part of the Orbicularis Oculi, it will intermingle with the fibers of the frontalis muscle. So that is the orbital part. So if you see the palpebral part, so as the name suggests, palpebral part is restricted to the lids. So again there will be one medial palpebral ligament and laterally there will be a raphe called as lateral palpebral raphe. So these fibers, they arise again from the medial palpebral ligament. They pass through the lids, the upper eyelid and even the lower eyelid, and they insert into the lateral palpebral raphe. So that is the insertion of palpebral part. Arises from medial palpebral ligament, inserts into lateral palpebral raphe. The lacrimal part, if we appreciate, so it is much similar, but the only thing is on the lateral side the insertion will be similar. It inserts into the lateral palpebral raphe. Only on the medial side the origin is different. Instead of arising from the medial palpebral ligament, it arises from a small crest that is present over the lacrimal bone. So it arises from this and again inserts into the lateral palpebral raphe. So its major action is on the lacrimal sac. That's why it is called as lacrimal part. So these are the attachments of Orbicularis Oculi. So next, if we see one more important muscle, the buccinator muscle. So this buccinator muscle, it is present in the buccal region. So it has got three fibers an upper fiber which arises from the maxilla, lower fibers which arises from the mandible, and middle fibers which arises from a raphe ear, which is called as pterygomandibular raphe, which extends from pterygoid bone to the mandible. So from the maxilla and the mandible, it arises opposite the 3 molar teeth. So it arises from part of the bone which is present opposite the 3 molar teeth. So there will be upper fibers from the maxilla, lower fibers from the mandible, and middle fibers from the pterygomandibular raphe. So what is the insertion of this? As we already saw, the facial muscle does not have any bony insertion. These lower fibers, so it will continue along the lower lip, whereas the upper fibers will continue along the upper lip. So it forms part of the Orbicularis Oris muscle. Whereas the middle fibers, so there is a difference in the attachments of the middle fibers. In the middle fibers, again the fibers divide into 2 parts, an upper part and a small lower part. So these upper lamina of the middle fibers, it will go into the lower lip, whereas the lower fibers, it will go into the upper lip. That means the middle fibers will decussate to reach the lips. So upper fibers goes into upper lip, lower fibers goes into lower lip, middle fibers again divides into a upper and lower part which will decussate at the angle of the mouth. So and the lower fibers will go into the upper lip and upper fibers goes into the lower lip. So this is about the buccinator muscle. So this buccinator muscle, it is pierced by various structures. So there are 3 structures which pierces the buccinator muscle. So one is the parotid duct which pierces it from outside to inside. Then there is buccal branch or buccal nerve, one of the branch of the mandibular nerve, a sensory branch which pierces it from inside to outside. And there will be some small minor salivary glands which will also pierce the buccinator muscle. So these are features of the buccinator muscle. So in the end, if we appreciate one more major muscle, that is the Orbicularis Oris. So this Orbicularis Oris muscle, it contains 2 types of fibers. Some are called as extrinsic fibers and some are called as intrinsic fibers. As the name itself suggests, intrinsic fibers are those which are present just within the lip, whereas extrinsic fibers are those which come from outer aspect and enter into the lip. So what all muscles we saw in the face region? That is the levator labii superioris alacanaceae, levator labii superioris, zygomaticus minor and major, levator anguli oris, the depressor anguli oris, depressor labii inferioris. All these muscles, they form the extrinsic fibers along with the muscles of the buccinator, which contributes mainly to the extrinsic fibers. So out of this buccinator, we saw how it merges and joins the Orbicularis Oris. So out of other extrinsic muscle, the levator muscles, that is the anguli muscles, that is depressor anguli oris. So it will send few fibers to lower lip and sends few fibers to the upper lip. Similarly, the levator anguli oris will also send fibers into the lower lip. Apart from that, other levator muscles are restricted to the upper lip, other depressor muscles are restricted to the lower lip. So these are the 3 major muscles that you should know the attachments. the Orbicularis Oculi, the buccinator, and also the Orbicularis Oris muscle. And in relation to this muscles of the face, there is one more point that you should remember, which is called as modulus. So this modulus, it is present on each side of the angle of the mouth. So it is a fibrous node basically, where as many as 9 muscles will unite, or 9 muscle will interlace at this point. So all the muscles that we saw, minor, major, anguli muscles, depressor and levator, the risorius, and even the fibers of the buccinator, they will reach the modulus, which is a fibromuscular node that is present lateral to the angle of the mouth. So if it is quite prominent, it can also be palpated from skin and mucus by putting our fingers, the thumb on the outer aspect and index finger on the inner aspect. We can actually palpate the modulus part. So that is one more point that you should know in the muscles of the face. So now we saw in the diagrams the various situation of the various muscles and in detail the attachments of the Orbicularis Oculi, Orbicularis Oris, and the buccinator muscle. So now if we appreciate the action of these muscles. So first if we take the Orbicularis Oculi, so it has got orbital part, palpebral part, and the lacrimal part. The lacrimal part, its action is related to the dilation of the lacrimal sac and helps in drainage of the tears into the nasal cavity. Whereas the remaining part of the Orbicularis Oculi, its major function is closure of the eyes. So some dust is coming, I have to close my eyes. Some impending injury, I have to close my eyes. That is produced by Orbicularis Oculi. So apart from that, the regular blinking action, so that is also produced by the Orbicularis Oculi muscle. So it is a motor muscle, so it is voluntary muscle, but as you can see, it is not completely voluntary. We can keep our eyes open for a certain period of time, but after that it will definitely blink. So apart from that, the winking action is also produced by the Orbicularis Oculi muscle. So this is the major action: closure, blinking, the winking movement, and dilation of the lacrimal sac for drainage of the tears or the lacrimal fluid. So that is the major action of Orbicularis Oculi. We can tightly close the Orbicularis Oculi, and during this tight closure, as you can appreciate here, you can see some radiating lines from the lateral angle, so which is more prominent in some individuals. So this is called as crow's feet. So that is the major action of Orbicularis Oculi muscle. Whereas the procerus muscle that passes into the nose and even the corrugator supercilii, they produces vertical wrinkles over the nose and also in the medial part of the forehead. Whereas the frontalis muscle, it produces horizontal wrinkles in the forehead region. So that is the action of muscles in this area. Whereas there is a muscle in the nasalis, the transverse part, the dilator naris, the compressor naris, which will compress the nasal opening. So that is action is not very prominent. Whereas the dilator naris, which is attached to the ala of the nose, it helps in dilation of the nose, in deep inspiration or deep expiration, and it is also sign of the anger. And if we appreciate the muscles that are attached to the upper lip, so there is levator labii superioris, levator labii alacae nasi. So as the name indicates, it helps in elevation of the upper lip. Whereas the muscles, the Zygomaticus major, which is attached to the angle, so it is the major muscle, so which will pull the angle. So when it gets pulled, when we are smiling. When we smile, if you appreciate now, there is elevation of the angle of the mouth, so that is produced by the Zygomaticus major. Whereas the lower muscles in this region, they will pull the lip downwards. So that action is produced by the depressor labii muscle, and mentalis will also help in pulling the lip downwards. Whereas the risorius muscle, which is present in this region, so it will pull the angle of mouth along with the depressor anguli oris. So that is a sign of sadness. So that is produced by the depressor anguli oris, not the risorius. Risorius helps in wide smile, so that is produced by the risorius. And during various movements, so you can see here there is a small furrow that will become prominent, which extends from nose to the angle, which is called as nasolabial furrow. So all these are the major actions of these muscles. So if you see two more major muscles, the Orbicularis Oris, it helps in closure and opening of the mouth. It helps in closure and opening of the mouth. And buccinator muscle, if you appreciate, though it is a muscle of the face, it partly helps in mastication also. So during chewing the food or during mastication process, some amount of food, it will accumulate between the cheek and also the teeth. So that gap between the teeth and the cheek is called as vestibule. So that food particles which accumulates in the vestibule, it is pushed inside by the contraction of the buccinator muscle. So indirectly it helps in the masticatory process. So apart from that, the buccinator muscle is also called as blowing muscle or whistling muscle. So it is called blowing muscle. We can push the air through this, and it is also helps in whistling. So this whistling action is also produced by the buccinator muscle. So these are the major actions. So facial expressions, there are numerous facial expressions of anger, smile, sadness. So all those, it is by combination of various muscles that will occur. Of course, difficult to show for me all the actions. So if you are able to demonstrate all the actions, that will be much better. So these are the actions of facial muscles. So these are the basic features of the face, the introduction, the skin and the fascias, the muscles, their action. So in the next part, we will see the nerve supply of the face, the blood supply and lymphatic drainage of the space. Do subscribe for future updates. Thank you.